So my take would be yes, there were 15 questions and all. I have out of that, I think I have got 12 or 13, and the one or two I think I'll get by another day or two. Okay. So hello everyone. Most of them were image-based questions, and yes, as Dr. Praneeth's question I can see, they were focusing more on the management part. Okay, they expected the undergraduates to know how to manage things. Okay, which is a little okay. Okay. So thought difficult. I would say it's a little difficult for undergraduates to know all the managements also. Okay. So let us recall. So first question which was there is this image was given. Okay, this kind of image was given in which they asked what is this instrument used for? And what is this instrument used for? This is JCC, Jackson's Cross Cylinder. Okay, this is used for refinement of cylindrical axis and power. Okay, it is made of two cylindrical powers, plus and minus. Okay, so there is plus 0.5, plus 0.5 in one axis and minus 0.5 in other axis. And there is a handle which is at right angles to this. Okay. Yes, this was there in one of the mocks. So Jackson's cross cylinder. And any other options? I have not been able to get the other options. Okay. ये तो correct है. Okay. B, C, D. Other options I'm still waiting for. As soon as I get, I'll let you know. But this was the correct option. Refinement of the cylindrical axis and power. The curvature of the lens. Okay. Curvature of lens was one option. Any other options? You know, visual acuity of. Okay, visual acuity. Nahi, visual acuity. So obviously, I'm very sure you guys know visual acuity is by Snell's chart and logMAR chart. ठीक है, यही याद है, वही काफी है. चलो, very good. That is absolutely right. Finding in the images given and what will be the preferred treatment. So they had given this kind of image. They expected you to reach the diagnosis and tell us the treatment also. Okay. So this was Horner Tranta spots, है ना? Horner Tranta spots. Seen in hot weather, है ना? Hot weather, which is VKC. And what is the treatment for VKC? It is mast cell stabilizers and steroids, है ना? Oral का तो कोई role नहीं. There is no role of oral antihistaminics. Antibiotic definitely no. Okay. Fourth option was surgery. Okay. Surgery क्या करेंगे इसकी? These are just the spots, है ना? Fourth option. Thank you for the fourth option, Dr. Ritika. Thank you. ठीक है. So this was a very easy question. And few, but I expected you to reach the diagnosis and then tell us the treatment. Okay. Next question, okay, where many of you have got a little confused between the vision and refraction. Some of you have got confused between these two concepts, okay. Child has a vision of 6 by 6 in one eye, the other eye is 6 by 60. The probable diagnosis is this. What I've gathered is that there was this not such a small question. It was a long question. It was a long question. And in this, they had given something like +4 diopter also. Kuch +4 diopter bhi diya tha. +4 diopter. This was a esotropic eye. Esotropic eye, which was there. So what was there? Okay. +4 diopter difference was there. +4 diopter difference. 4 diopter both eye. Okay. 4 diopter both eye. So yani ki if they have given +4 diopter both eye, that means that refraction is same. है ना? Refraction is the same. So how it will be anisometropic? Anisometropic में refraction has to be different, है ना? Okay, so both eye has, yes, +4 diopter for both eye, तो refraction anisometropic नहीं रहेगा. So this is strabismic amblyopia, है ना? Strabismic squint. One eye has 6 by 60, the other eye has 6 by 6. Okay, 6 by 60 and 6 by 6. Some cover test was mentioned with it. Okay. Cover test. Okay. If you do cover test in this patient also, even then when you cover this eye. So if you cover this eye, okay, if you cover this eye, what will happen is this eye will tend to move in the center. Okay. This eye will move in the center even if it is amblyopic. Okay. Even with amblyopia, this eye will definitely move. Good eye deviates when disease eye covered. Yes. But a disease eye to this one. This is the disease eye, na? And this is the disease eye. If you cover, तो disease eye कैसे होगा? ठीक है? 6/60 था या 6/36 था? Even then, it is a strabismic amblyopia. ठीक है? Strabismic amblyopia. Amblyopia. Question was on amblyopia. Question was on amblyopia. Choices were amblyopic only. Some other choices. I hope the choices were on amblyopia only. है ना? ठीक है? So here it is the strabismic amblyopia because the squinting eye, the eye which is squinting, okay, squinting eye undergoes amblyopia. That is, vision is less than 6/36 or less 6/60. The vision is reduced. Okay, beta. Good job. Very good. Very good. Next, there was this question with post chemical injury. है ना? Chemical injury, some say. So there was this image which was given. Again, an image-based question. Lot of image-based questions. ठीक है, कोई बात नहीं. So question. So that is where Dr. Mahmood we need to see. Here it is symblepharon, beta. Symblepharon. Ankyloblepharon is when the two lids are joined together. Here the conjunctiva is joined to the eyeball. Okay, the lid is joined to the eyeball. So this is what is called as symblepharon. Okay. So this is symblepharon. Okay. Next, which was there, question number 5. Very simple. We have done this in our class. We have done this by this name only. Investigation of choice. Investigation choice. Okay. This image was given. Again, they expected you to see the image, reach a diagnosis. So the diagnosis is keratoconus, and then tell us. So it was a multiple. What I believe in this FMG exam, they have done it in a multiple level. So they wanted one level and then second level. So first level is reach a diagnosis and then tell me what is going to be the diagnosis, the treatment of choice, the investigation. It is going to be topography. Yes, topography. That is the correct option. Corneal topography. Absolutely done. And we have done this. This was there in the class. Okay. Good. All good till now. So questions were, yeah, this is Munson sign. Absolutely good. Questions were a little tricky, but they were from your PYQs and PYTs. All the questions that we have done till now are from PYQs, PYTs. Okay. But yes, it was a little tricky way they had asked. They asked, yes, they asked the treatment, they asked the management. They expected you to be thorough with your knowledge. Okay, very good. Now, this kind of image was given, and then given something like restricted ocular movements. Full option sclerotopography. Sclerotopography, अच्छा. Sclerotopography. Sclerotopography कुछ नहीं होता बेटा. ठीक है. Yes, this was thyroid eye disease. Absolutely good. Thyroid eye disease. It is not orbitocelitis, not cavernous sinus thrombosis. In both of them, there is going to be inflammation. The inflammation is a part. Inflammation includes redness of eyes, है ना? Red nose, redness. Here it was, the eye was not red at all. This kind of image was given. Bilateral proptosis. Okay, so this was a thyroid. Idiopathic bulging. Okay, fourth question was idiopathic bulging. Idiopathic bulging. Here also what I have gathered is that it was a long question. It was a long question, which you are unable to recall. Many of the students are saying, sir, questions were 4 line, 5 line long. Okay. Inflammation, dryness. Okay, so there was given inflammation, dryness was given. One student was saying the patient had a bindi. Female patient. They were asking, they were saying it's a female patient. Too much information. Too much information. one of the options was ultrasound B scan. Okay, one of the options was ultrasound B scan. Okay, so I think this option was not there. Maybe ultrasound B scan was there in this option. Okay, chalo, वो भी नहीं है. That's not the correct option. Increased intracranial pressure with feeling of pulsation also mentioned. Increased intracranial pressure. Okay, वो उसका क्या रोल होगा? Increased ICP with pulsation. Pulsation क्यों? In keratoconus, A scan given. अच्छा, in keratoconus, A scan was given. Okay, one was A scan. So biometry भी नहीं रहा होगा ऑप्शन में. तो one was A scan, one was ultrasound B scan, maybe topography, pachymetry. Very good. Thank you for filling up the choices. But here the answer is thyroid disease. Okay. Moving on to the next question. Question number 7. This kind of image, again an image question. Now they wanted to ask the treatment. So again, reach a diagnosis and then tell us the treatment. So this is a viral keratitis. This was clear. Viral keratitis. Some people are getting confused whether it is a geographical ulcer, whether it is a dendritic ulcer. But here to viral keratitis. Okay, branching kind of pattern. This kind of pattern is seen in viral keratitis, whether it is geographical, whether it is your dendritic ulcer. And treatment is acyclovir. Treatment is acyclovir. ठीक है, कॉर्नियल केरोटोमेट्री. यस, कॉर्नियल टोमोग्राफी लिखा होगा. वेरी गुड. Almost 150 image questions. Oh my goodness, that is too much. I believe so. As an examiner, I'm telling you, it's a little tough. It is a little tough for patients, the students, to see the question, see the image, reach a diagnosis, then tell the answer of the. So it is a little tough. Okay? Otherwise, the questions are okay. Acyclovir 3% cream with atropine. Okay. And okay, one option was Ganciclovir. Ganciclovir, nahi beta. Ganciclovir is not the correct option. That is there. Hemangioma was there in question 6. Acha, one was hemangioma. Okay, ठीक है. Maybe I'll confirm this. हाँ, आ रहे. टेरिजियम सर्जरी पे आ रहे. इसमें ऑप्शन ऐसे एंटीवायरल, एंटीबैक्टीरियल भी थी. ओके, एंटीबैक्टीरियल ड्रग्स भी थी. एंटीबैक्टीरियल ड्रग्स सी. ओके, अच्छा, अदर 3 वर एंटीबायोटिक. ओके, सो बी सी डी यू आर सेइंग वर एंटीबायोटिक्स. सो गैनसाइक्लोविर नहीं था एज पर यू. ठीक है, डॉक्टर विष्णु. सो एंटीवायरल था ना. दिस इज एंटीवायरल. द ट्रीटमेंट हेयर विल बी एंटीवायरल बेटा. Okay, good. Next. So one was this image where the test of choice for the patient for given image. So again an image. What is this image? This is basically an image showing KPs. That is seen in uveitis. And these KPs are on the cornea. है ना? So this is an HLA-B27 associated uveitis. HLA-B27 associated uveitis. Okay. एंटीवायरल ऑइंटमेंट विद साइक्लोविजिक. ठीक है, तो एंटीवायरल ऑइंटमेंट विद साइक्लोविजिक. अच्छा, एंटीवायरल लिखा हुआ था. ओके, तो गैनसाइक्लोविर किसी को ऐसे ही याद आ गया. एंटीवायरल ऑइंटमेंट विद एट्रोपिन, दैट इज द करेक्ट ऑप्शन. इसमें HLA-B27 था ना, तो HLA-B27 इज द करेक्ट ऑप्शन. एंटी CCP एंटीबॉडी दिया था. ओके, एंटी CCP एंटीबॉडी नहीं, वो भी करेक्ट नहीं है. HLA-B27 will be best. Question 7. Antifungal, antimicrobial. ओके, ठीक है, अंडरस्टूड. वेरी गुड. चलो अब आगे चलते हैं. वो हो गया क्वेश्चन. लेट अस मूव टू दिस वन. इसमें कुछ और, क्वेश्चन में कुछ और था. एनीथिंग व्हिच वाज पेक्यूलियर टू दिस क्वेश्चन? It was not B27, it was anti-CCP. But actually B27, many have told me. ठीक है. Many have told me that it is HLA-B27. Dr. Abhishek Tiwari. If not, okay, then what you can do is you can WhatsApp it to me at this number. Let us discuss at this number. ठीक है. HLA-B27C. Dr. Rajkumar is telling. Many students have said कि HLA-B27 था choice में. Unless there were different sets of paper. ठीक है. तो यही होगा. Next. This is a question where one bouncer has come. Treatment of choice for the patient with pterygium. Ideally, it should be surgery plus autograft. But one student is telling me that there was written that this is encroaching the pupillary axis. Encroaching the pupil axis. Yes, it's there. देखो. ठीक है बेटा. डॉक्टर अभिषेक तिवारी सी लॉट्स ऑफ स्टूडेंट्स आर सेइंग कि था. ठीक है भाई. चल मान जाते हैं. लेट अस एग्री. अब मान ही जाते हैं क्योंकि इतने सारे लोग कह रहे हैं. आजकल वही है ना, मेजॉरिटी विंस वाली स्टोरी है आजकल. नोबडी बिलीव्स कि सिंगल पर्सन कैन बी राइट. मेजॉरिटी विन होता ना. आ जाओ. सो नाउ कम टू नेक्स्ट क्वेश्चन. हाँ. एनक्रोचिंग द pupil axis था क्या? See, because if the pterygium is encroaching the pupil axis, then you have to wait and watch for the pterygium to grow over the pupil. No picture was there. No picture was there. अच्छा 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 अच्छा. For a change, no picture was there. अच्छा, no image. ठीक है ठीक है ठीक है ठीक है. ओके. इमेज डिलीट. तो लिखा क्या था? हाँ वो आ रहा हूँ. डॉक्टर सविनीत कोहली सेठी. ओ भाई साहब, इतना लंबा नाम है. आ रहा हूँ बेटा, आ रहा हूँ. दैट क्वेश्चन इज देयर. कमिंग टू दैट क्वेश्चन ऑल्सो. नो पिक्चर वाज देयर. चलो ठीक है. नाउ टेरिजियम एंक्रोचिंग द प्यूपिल एक्सिस था, लिखा था. रीचिंग द कॉर्निया ना. रीचिंग द कॉर्निया तो है ही. टेरिजियम विल रीच द कॉर्निया ओनली. टेरिजियम विल डेफिनेटली रीच द कॉर्निया. रीचिंग कॉर्निया. यस. नो पिक्चर. दिस इमेज वाज नॉट देयर. ठीक है. हाँ आई एग्री. दिस इमेज वाज नॉट देयर. ठीक है. डिलीट हो गई इमेज. फॉरगेट द इमेज. ठीक है. तो अगर खाली टेरिजियम था, एंक्रोचिंग द कॉर्निया था, देन द ऑप्शन इज सर्जरी प्लस ऑटोग्राफ्ट. बट इफ द क्वेश्चन सेड कि इट इज एंक्रोचिंग द प्यूपिल एक्सिस, देन इट वुड बी वेट एंड वॉच. यू वांट द टेरिजियम टू ग्रो. फ्रंट नेजल साइड भी ठीक है. सारे टेरिजियम नेजल साइड ही होते हैं. सारे टेरिजियम नेजल साइड ही होते हैं. हाँ ठीक है. ओके. रिमूव आई. हे भगवान. एक क्वेश्चन था रिमूव आई. एक ऑप्शन ये था रिमूव द आई. पूरी आई निकाल दो. नो पीपल एक्सेस मेंशन ना. ठीक है. सो ओनली वन स्टूडेंट मेंशन दिस. सो आई विल रिमूव दिस. नहीं, फेस्टून पीपल आगे था बेटा. वो आते हैं आगे. एक लेंस सबलक्सेशन इमेज वाज गिवन. वाज देयर अ क्वेश्चन ऑन लेंस सबलक्सेशन? लेंस सबलक्सेशन पे कोई क्वेश्चन था क्या? था. तो व्हाट वाज द क्वेश्चन प्लीज? आई एम नॉट एबल टू गेट दिस क्वेश्चन ऑल्सो. नीदर आई हैव बीन एबल टू गेट द choices. I just got to know that there was a question on lens subtraction. ठीक है. I'll see and get back to you later on. एक ये क्वेश्चन था. Blunt trauma to eye. अच्छा, इसमें इमेज था. ओके. दिस वाज एन इमेज बेस्ड क्वेश्चन, सो आई हैव टू सर्च फॉर द इमेज आल्सो. चलो करेंगे. ठीक है. नाउ दिस इज blunt trauma to the eye with a tennis ball present with given image. है ना. आफ्टर कैटरेक्ट सर्जरी. आफ्टर कैटरेक्ट सर्जरी. आफ्टर कैटरेक्ट सर्जरी. ओके. What's the immediate post of cataract complication after? Inferior subluxation image was there. Inferior subluxation image was there. IOL was luxated. Post cataract surgery, what will happen? Opacification of IOL. Opacification, subluxation, aphakia. हे भगवान, क्या क्वेश्चन है यार? ओपेसिफिकेशन ऑफ आईवल क्यों होगा? पीसीओ होगा यार, विद इन कैटरेक्ट सर्जरी. चलो देखते हैं. I'll get back to this. Now, what was this? Presents with given image. Tennis ball injury presents with this given image. This was obviously, आ रहा हूं उस पे भी आ रहा हूं. This was obviously hyphema. Obviously hyphema है ना बेटा, ये hyphema ही है. 8 ball hyphema हमने ट्रॉमा किया है. We have done this repeatedly ट्रॉमा में, and we have done this same image. Yes, good, thank you. हाँ. And one question was on, so question 12, one question was on LASIK, surgery criteria. ठीक है ना, where they had given one, age 13 years, corneal thickness they had given as 480 microns, है ना. One question was, one choice was 6 diopter या फिर शायद 4 diopter myopia. Cannot be done. LASIK surgery cannot be done. Cannot. ठीक है. और corneal thickness 480 micron. So you can do here, you can do here. You cannot do in age less than 13 years. Age less than 13 years नहीं था. ठीक है. हाँ 4 diopter ठीक है. चलो 6 diopter नहीं था. Not fit for surgery ना. हाँ अच्छा ठीक है. एक वो था stable for 1 year. Stable for 1 year. ठीक है. Now, one question which was there was question number 13, which is there was a festooned pupil image, festooned pupil image was given, where they are saying along with myotics, what drug given to break the signing. Okay, I had put this question. I don't know why this question is not there in my PPT, but I had written this question. But चलो कोई बात नहीं. One was atropy. Second was cyclopentolate. ठीक है. One was phenylephrine. And one I think was scopolamine. है ना. One was scopolamine. I think these were the 4 options. Cyclopentolate ना. So see, which of the following is not a criteria for LASIK? Yes. So age 13 is not a criteria. It is not a criteria for LASIK. Yes. Stable refraction for 1 year is conjugate 480 micron. Yes, is. हाँ ठीक है. So इसमें the correct answer is atropine बेटा. The correct answer is atropine. Atropine is something which is the strongest. This is the strongest cycloplegic mydriatic. Cycloplegic mydriatic. So that is why you use atropine to break the signing K. Age 113 years. Think. So phenylephrine was also there. Prevent. Yes. So atropine is something which is given beta. We have done this. It's the most important adjuvant drug for uveitis. Apart from steroids, this is the most important drug that we give. गलत नहीं मेरा. तो simple था यार. Atropine we have done. They have just twisted the question. This was there in our class also. What is the most important adjuvant drug? है ना. अच्छा, one glaucoma question was also there. Okay. Question 14. One glaucoma question was also there. Along with myotic. I don't know why they're given along with myotic. Please understand, myotics are contraindicated. Okay, I don't know why they have written this, but I'll write it here. Myotics are contraindicated in uveitis. ठीक है, because they will worsen the synechia, worsen the inflammation. Myotics are contraindicated. I don't know why they've asked this. Okay. Now, one question on glaucoma you are saying was there. What was this question? Which drug breaks myotic action? So atropine breaks the myotic action. Atropine breaks the myotic action. ठीक है. Which drug add with myotics? I don't know why you will add with myotics. Add क्यों करेंगे? Myotic देंगे ही क्यों? Why would you give myotic only? There is no reason to give any myotic. Secondary glaucoma tha. Other option was. Acha. So here you are saying one option was open angle glaucoma. One option was secondary glaucoma. Okay. Glaucoma with the image. Here also it is image based question. Oh my goodness. So out of 14 questions, 15 questions, I think 13 were image based. Only one was not image based. ऐसा था क्या? Lot of image based question. Good. चलो. So we'll search for this question also. One primary glaucoma. अच्छा. तो open angle glaucoma हो तो क्या? Primary open angle glaucoma. That is primary glaucoma only. Okay. Angle closure glaucoma. Okay. So one you are saying is angle. Choice C was angle closure glaucoma. But what was the question? Question is, what was the question? That is my question. What was the question? Mention pain and redness in the previous question. अच्छा, pain and redness. अच्छा, pain redness mention कर दे यहाँ पे. ठीक है. Pain and redness. चलो, करेंगे mention. ठीक है. For the timing, I hope you were able to answer them. They were little tricky questions. I would not say they were easy questions. But yes, they were all your PYQs, PYTs. So if your concepts were good, I think you should have answered them. ठीक है. ये मेरी तरफ से था. ठीक है. And hats off to all your efforts. And a big thank you to everyone who has contributed to this recall. ठीक है. That is what I can say. And all the best. And see you soon at Cerebellum Hum. है ना? Let us all hope that we clear this exam.